It seems like you can't even turn on the TV, scroll through your timeline, or walk outside without hearing something about the COVID-19 epidemic. And honestly, it is a serious case of information overload. You're not sure what to believe, and conflicting information is constantly being thrown at you. So we're here to clear up some of the muddy waters and answer some of the most common myths about COVID-19. Before we talk about COVID-19, or SARS-CoV-2, first we have to ask, what even is a virus? A virus is a tiny infectious particle that can reproduce only by infecting a host cell. Viruses hijack the host cell and use its resources to make more viruses, basically reprogramming it to become a virus factory. Because they cannot reproduce by themselves without a host cell, viruses are not considered living. This is also why antibiotics are not effective against treating viruses such as COVID-19. Viruses can enter our body in several different ways, including direct contact, indirect contact through surfaces or droplets, common vehicles such as food, water, and blood, vectors such as animals and insects, or airborne transmission through evaporated droplets or dust particles that are suspended in air for long periods of time. So that brings us to the question, how can we prevent ourselves from being infected? By now, you have probably heard of the 6 feet standard of social distancing. But people have asked, is 6 feet enough? The distance number has its origins in the 1930s and 1940s as a recommended space to prevent tuberculosis spread, which was also spread by similar respiratory droplets that, like COVID-19 droplets, would typically fall within 3 to 6 feet due to gravity. However, recent studies have suggested that respiratory droplets associated with COVID-19 could be suspended in the air for 3 hours and could travel up to 27 feet, and that's not including added distance from physical outdoor activity. With these findings, it is safe to say that 6 feet is the bare minimum to fight the virus, and it would be best to stay away as far as possible within reason. The other most frequented prevention topic is masks. The Center for Disease Control and the World Health Organization have both recommended the use of cloth face coverings in public settings when around people outside of their household, alongside social distancing, but especially when social distancing measures are difficult to maintain. Cloth masks reduce the spread of droplets to around 6 inches and even surgical masks to around 8 inches. The only people recommended not to wear a mask are children 2 years or younger, those who have difficulty breathing, or anyone who is unconscious, incapacitated, or otherwise unable to remove the cloth face covering without assistance. No, wearing a mask for too long cannot harm you, and you should clean them regularly. Dr. Hong at the University of California in San Francisco says that studies are showing asymptomatic and pre-symptomatic transmission of the virus is possible. But because people are at risk for spreading the virus without knowing they have it, everyone should wear a mask. With the ever-growing and non-stop news feeds from various social media outlets, it is really easy to gather creative yet ineffective home remedy options. The most common ones are hard liquor or spirits for hand sanitizer, household cleaner injections or ingestions, and even considering the virus is a hoax. There are plenty more, but the answer for most of them is no, no, and no. The Center for Disease Control recommends at least 60% alcohol for hand sanitizers, which most liquors and spirits do not reach. Household cleaners were never designed to be injected or ingested and will cause much more harm than good. And finally, this virus is very much real and must be taken seriously to keep you and your loved ones safe. But what should you look out for in case you do get infected? The common symptoms of COVID-19 include fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of smell or taste, sore throat, congestion, vomiting, and diarrhea. If you believe you are experiencing symptoms of COVID-19 or have been exposed to it, please contact your primary care doctor or urgent care clinic. If you are in Georgia, you can be tested free at locations found through the Georgia Public Health Department. Direct patient lines for the Augusta/East Central Health District can be found at mcgcovidresponse.com, as well as the answers to many more questions and myths. Remember, if you have a question that was not answered, please submit it at the bottom of the Mythbusters section of mcgcovidresponse.com, and we will try to get a response uploaded to the website as soon as possible. Remember to protect yourself and others by using a mask and social distancing. And together, we can work towards a healthier future.